But I'm actually excited to have everyone here in person today for this 29th annual faculty author celebration. As you know, for the past couple of years, we've been doing a virtual only presentation, so it's so nice to have you all back. When we did the virtual presentation, when we shifted to that, we started creating videos of all of the speakers, which is really nice. There's a benefit to that. We have this artifact of the record of some of the speakers and recordings of their words as they talked about their research as we move forward for our archives. The other thing that actually was nice is that we had 100% participation of all of the awardees and words from the deans and words from the chairman representing those awardees departments, which was, I think, really, really nice. But the thing that was really missing in that situation is some community. So I do hope that, albeit brief, that you enjoyed the reception, and that maybe you have an opportunity to meet some new faces, put names to faces that you had not seen before. I've seen many people that I've only been seeing on video for the last couple of years, and that's been really nice. So what we're going to do is we're going to play the video. The awards are in there. And for those awardees who are here, when your video completes, if you could step forward to the podium so that we can honor you and give you your certificate and gift. So before I get ahead of that, I do want to make sure that we're honoring every 2021 author in the room. Can I see a show of hands? Where are my authors for 2021? So I just want to thanks to all of you for the honor that you do to New York Medical College with your hard work and dedication. For many of you, I know it's been very difficult to get back into the labs during the pandemic. So this return to normalcy, I'm sure for all of us, is very welcome. So we thank you for your work and your commitment and for contributing to the New York Medical College research footprint. In a few minutes, Dr. Amler is going to provide some of the 2021 NYMC faculty author stats, so I won't rain on his parade except to say, really thank you. As an institution, we have much to be proud of in terms of the contributions that we make to science and medicine. I am going to put forth one mundane plea as we talk about moving forward, is to make sure when you do publish your articles that you put New York Medical College in as an affiliation. It's really hard for us to identify articles or find articles that don't somehow say New York Medical College on them. And really that's the whole point of one of the things we're doing here is sort of celebrating all of those New York Medical College publications. So we won't find them, and the world won't know that you came from New York Medical College unless you include that on your articles. There are definitely some articles that are missed in the annual bibliography because we didn't know, because it doesn't say New York Medical College on it. So in a few moments, we're going to move forward to the awards portion of the event. And these represent articles that rose to the top in a variety of countable ways. We honor all of these awardees, and we are recognizing that there's many ways in which a lot of really great research might not ever see one of these awards for really just so many reasons. They might not have a quantitative impact while being extremely significant to the momentum of science. So please recognize we're here to celebrate every single author, those in the room and those not in the room. And I hope you, as I said before, had some time to mingle and with other authors and continue to do so after the event. So one thing I wanted to call special attention to, we didn't actually include it in awards or videos, but we're editors and authors of full books, which is a monumental undertaking, as any one of you who's either edited or authored a book knows very well. So I'm just going to actually quickly read through the names of authors of books and their titles. So the first author is an editor, Dr. Al-Mufti for his book, Cerebrovascular Disorders, which he edited. Here. And also Dr. Wilbur Amler, who is in the audience, who edited the Management of Dyslipidemia. Dr. Michael Blumenfeld for Shrink Talk, Reflections and Writing from a Psychiatrist. Dr. T.S. Dharmarajan, who edited Geriatric Gastroenterology, which is now in its 2nd edition. Michael Golodgorsky, also I did lay eyes upon, who edited his 2nd edition of Regenerative Nephrology. 2 books edited by Dr. Stefan Mayer, Merit Neurology, the standard, which is in its 14th edition, and the Mount Sinai Expert Guide to Critical Care. The next author, unfortunately, is posthumously honored today, Dr. Raymond Phillips, who was the author of Venous Insufficiency and who passed away in July of 2021. And the last author or editor is Dr. Eric Rosenberg, who edited Operative Dictations in Ophthalmology. And then another interesting thing happened this year. We received a report that I wanted to actually just mention, again, without an actual award, that the following faculty members and authors, many of whom are here today, were ranked from a source called research.com, which I followed the methodology to some point, which is kind of an interesting thing. They took a point in time on where that person was, and they calculated what's actually called a D index, which is similar to the H index, which we've talked about here before. And I'm going to call out these names. Just please hold your applause so that we can get through it. But in the top ranked list, we saw several New York Medical College authors, so I just wanted to name them. This is based upon the number of their publications which received a high number of citations. And they include Dr. Giulio Panza, Dr. Wilbur Aronow, Dr. Gary Wormser, Dr. William Frischman, Dr. Leslie Citrome, Dr. Akos Kohler, Dr. Mitchell Cairo, and Dr. Gary Williams. So what I really just want to do at this point is thank my staff at the Health Sciences Library for all of the hard work that they do in putting together, not just the bibliography, but also this event, particularly in this new format, which requires a lot of work on the part of Jeanette, April, in getting all of those videos, getting them together, and also working with educational media, who also deserves a lot of thanks in editing the video and pulling together. So we're going to do that in just a minute. I want to mention that Nina Kurzban, our cataloger and metadata librarian, who's worked on this bibliography really on her own largely for the last 10 years, and contributed to it heavily in the years before that, retired this year, and there's a brief video of her at the very end of the video. So at this point, just one more thing, there's a sign-up sheet out at the table where if you want a copy of the print bibliography, which is currently still at the printer, we'll mail you a copy, or you can come pick it up in the library, so you can sign up and leave your email address there. Okay, so now I'd like to invite Dr. Solomon Amar, Vice President for Research at New York Medical College, to the podium to make a few remarks, and he'll be followed immediately by Dr. Michael Boland, Professor of Physiology and Chair of the Library and Academic Support. Thank you.
Tremendous pleasure that I have to be standing here. Last time we did it, I think it was in 2018 in the hall outside. 19. And we celebrate 2021, which is basically the midst of the pandemic. with all the stress and all the pressure that we had, and this community came along seriously with a significant movement into the placement into the bulk of what the knowledge is nowadays, ingrained into the literature, present, projecting New York Medical College, and defining new knowledge, new science that is going to remain for posterity, and most importantly, that is now used for development of new medication, new science, and hopefully being able to provide the future generation with a better world. So this faculty award started in 1995 with articles that recap the years 1990 to 1993, and just as an element of comparison, there were 435 total publications with no breakdown that I have. Today, we celebrate 1,010 publications that are basically 9 books, 69 chapters, 130 abstracts, and 892 journal publications, which is a significant placement of New York Medical College in the body of the literature. What's more, basically, according to the database of Web of Science, we have already been about 3,000 or 2,800 times being cited for paper published in the 2021. And this is in fact, as I said earlier, during the midst of the pandemic, when everybody was not knowing what the future would hold, not knowing what we would do tomorrow. Yeah, the labs are going to be open, closed. We are, and still we came along. So I just want to highlight that this doesn't come in a vacuum. Resilience and critical thinking are extreme factors for the development and of a successful investigator that will carry such accomplishments. I congratulate you, I congratulate the others, and with the significant new development, you've seen all the constructions that we have on the floor over here, you've seen new hires. New York Medical College is being significantly rejuvenated. I'm not a plastic surgeon, but we are making a serious lift on the face of New York Medical College with new hires. I'm looking forward to the future that is being charted by you, and that will hold and develop betterment of public health and public conditions. Thank you very much. I'd like just to finish to thank Mary and her staff for the tremendous work that they put, not only right now on this event, but all along the years, by being present anytime that we need an article, anytime that we need a citation, and for that we're extremely grateful to you and to your staff. Thank you.
Hi, I'm Mike Walden, Chair of the Library and Academic Support Committee. I'm delighted to be back live for this event because it's such a meaningful event. The Library and Academic Support Committee represents as many segments as we can include possible on it for the university, the different schools, the administration, the students, and this event really honors the accomplishments of the school because it documents all the publications that will go on to really lead science. And it's interesting to take a look at like something that tracks these things. Like I look at Google Scholar. And if you ever search New York Med within Google Scholar, you'd be pretty amazed at what things are there. And it often cites for the highest number of publications. Highest number of citations of publications. Excuse me. And so you can see what impact people have published and what it's gone on to. And now we have a fresh group of new faculty members, which is bringing new blood into the basic sciences here at New York Medical College. In addition, the environments in many segments of school are warm and very receptive to research, and the med students recognize the importance of research, and the dental students are even here in this building working in some of the basic science labs. And so the school has a really wonderful atmosphere to culture the academics and scholarly activities that this event honors. Thank you.
Good afternoon. My name is Edward Halpern. I'm the Chancellor of the College, and want to welcome everyone to this year's authors event hosted by our beloved librarians at the Health Science Library. I think it's a good year to think about the scientific enterprise and the opening lines of Charles Dickens' book, A Tale of Two Cities. It was the best of times, it was the worst of times. It was the age of wisdom, it was the age of foolishness. It was the epoch of belief, it was the epoch of incredulity. It was the season of light, it was the season of darkness, it was the spring of hope, it was the winter of despair. That's a way we could think about science and the generation of new knowledge. It was the best of times. Never in the history of humankind have we gone from the identification of a new human infectious disease to its DNA sequencing, to the public knowledge of that sequence, to the development of new innovative vaccines, to the mass production of those vaccines, to the launch of a mass vaccination campaign, all within the space of months. Never in human history has the triumph of science been seen in such a manner. And never in my experience in life have we seen such a full frontal assault on the concept of expert knowledge, on science, on truth as opposed to made up science, on politicians interfering with the scientific process and the dissemination of reliable new knowledge. It is the best of times, it is the worst of times, it is the age of wisdom, it is the age of foolishness. What are we to do? Well, I suppose the easiest answer is to say we need to keep doing what we're doing about the generation, conservation, and dissemination of new scientific knowledge and its codification through publication in the peer-reviewed literature. But I'm increasingly thinking that that's necessary but not sufficient. And we should pay particular attention in today's program to the awards for those publications from our college that had the largest number of hits on social media, the largest impact on the public. We need to be giving serious thought to the dissemination of real science, of real peer-reviewed, tested, reliable science, and make the public understand what is known and what is not known and how we come to say something is known. And we perhaps need to climb down a bit from the ivory tower and spend more time understanding how our work can be disseminated on social media and the press to the public. As always, I'm grateful to the staff of the library for the creation of today's event. My congratulations go to all of the award winners, and I wish the faculty Godspeed in their good work of the generation of new knowledge. Glad to be with you today.
Hi, my name is Humayun Islam. I'm the chair of the Department of Pathology, Microbiology, and Immunology at New York Medical College, and also the director of pathology at Westchester Medical Center. Today, it is my great pleasure to announce the award recipient for research article published in journal with highest impact factor for a New York Medical College first author in 2021. And the award goes to Dr. Paul Arnabaldi, who is an assistant professor in our department. The article was published in the Journal of Clinical Infectious Diseases with an impact factor of 20.999. And the title was Detection of Interferon Gamma Secretion in Blood Samples Collected Before and After Treatment of Various Stages of Lyme Disease. Let me briefly mention Paul's research interest. His lab focuses on two major areas, mucosal vaccination and diagnosis of tick-borne diseases. Since joining NYMC a decade ago, Paul and his team work relentlessly to develop diagnostic assays for early detection of Lyme disease in order to prevent disease dissemination and thereby to improve patient outcome. This article also deals with a reliable detection method for various stages of Lyme disease. I'm really proud for Paul's achievements and delighted to introduce him. Congratulations, Paul. Thank you.
I'd like to thank you for recognizing our work in our publication, Detection of Interferon Gamma Secretion in Blood Samples Collected Before and After Treatment of Varying Stages of Lyme Disease. This work has been a long-term collaboration, more than a decade now, between my lab, the lab of Dr. Datweiler, as well as that of Dr. Callister at Gunderson Lutheran Medical Center and the Department of Pediatrics here on the development of improved diagnostics for Lyme disease. Specifically, this assay that we've developed that was highlighted in this publication is an interferon gamma release assay for Lyme disease. It's the first of its kind. And what it does is it measures T cell responses in patients with Lyme disease, which is quite different than the normal serological responses that are measured by current diagnostic assays. And we found that measuring T cell responses through interferon gamma secretion gives some advantages over serological antibody detection in several ways. It seems to be a more sensitive measure during early infection, being able to detect more patients with early disease than the current antibody tests, which are actually quite poor at that. Also, and perhaps more importantly, we've noted that interferon gamma secretion goes down after treatment, indicating that this could not only be a test to detect disease in patients or to support a clinical diagnosis of Lyme disease, but that it could also be a measure of potential cure, although more study needs to be done on those aspects of it. We've also noted that in few patients we've had with prior Lyme disease that interferon gamma secretion is able to distinguish between patients that have current active infection versus past infection, which is something else that serological studies can't do. We've been moving and developing this assay along now for over a decade, and it's finally reached a point with some commercial collaborators where it may actually make it to market and into use, and hopefully the assay will improve care for patients with Lyme disease. So thank you again for recognition of our study, and hopefully we'll have more good news on this front shortly in the future.
Hello, my name is Dr. Jerry Nadler, Dean of the School of Medicine at New York Medical College. As Dean of the School of Medicine, it brings me great pleasure to join in this very important event here at New York Medical College, where for nearly 30 years, we have annually recognized New York Medical College faculty authors for their important contributions to advance science across a wide variety of disciplines. I am honored now to present the award today for the research article with the highest number of citations for New York Medical College first author. This award goes to Dr. Stephen Ferrando, who is chair of the Department of Psychiatry and Behavioral Sciences and director of psychiatry at Westchester Medical Center. This important work, entitled Psychiatric Emergencies During the Height of the COVID-19 Pandemic in the Suburban New York City area, was published in the Journal of Psychiatric Research in April of 2021. The study amassed an amazing 35 citations and is among the top 1% in citations for the field of psychiatry and psychology for the publication year in the Web of Science. This is a very important study and impressive accomplishment, and really followed these patients characterizing when they presented for psychiatric emergencies during the COVID-19 pandemic, and describes COVID-19 related stressors. This study, which has now been cited, is clearly affecting improved care for these patients and indicates opportunities for further improvements as these patients are followed in a cohort in the future. I want to thank Dr. Ferrando for his work, but also this represents a major team effort. It involves Superstar Medical Center medical students who have now graduated New York Medical College and on to their careers, as well as colleagues in Dr. Ferrando's department and colleagues in the Department of Emergency Medicine. I want to thank Dr. Ferrando and his team, and I want to now introduce Dr. Ferrando to say a few words about this important publication. Thank you.
Hello, this is Dr. Stephen Ferrando. I'm the chairman of the Department of Psychiatry at New York Medical College, and I'm the director of psychiatry at Westchester Medical Center Health System. I'm very grateful to receive this recognition for our team's work on the mental health consequences of COVID-19, particularly emergency room visits during the height of the COVID-19 pandemic that we saw during March and April of 2020. Before talking a little bit about the research itself, I really would like to acknowledge our team, because without the efforts of all of us who contributed to this, it would not have happened. So this is not done in isolation. In particular, I'd like to acknowledge Dr. Lydia Klepacz, who is the Director of Emergency Services at WMC Health and Associate Professor of Psychiatry and Director of our Behavioral Sciences course for the Medical College, a very important part of our educational activities. Dr. Rhea Dornbush, who has been instrumental in promoting research in our department, is a member of the IRB and importantly, a neuropsychologist who has been very involved in collaborating with some of our subsequent longitudinal work on the post-acute sequelae of COVID-19. I'd also like to acknowledge Dr. Bartel, our vice chair, Dr. Ivan Miller, the director of emergency psychiatry, and last but not least, two superstar medical students that are recent graduates from New York Medical College, Sean Lynch, who's currently a psychiatry resident at Mount Sinai Beth Israel, and Sivan Shahar, who is a combined pediatric and child psychiatry resident now at Mount Sinai. Again, without the efforts of those students, we really would not have been able to produce this work. Now, a little bit about the publication itself. As I said, this dealt with emergency room visits during the height of the pandemic, just after the first cases of COVID-19 were identified. And of course, people were starting to get very ill and dying of COVID-19 complications. And during that time, we began to notice a couple of things. First of all, as with other departments, the volume dropped at least for a couple of months, and that included in the psychiatric emergency area. However, importantly, we primarily saw the drop in child and adolescent patients. The patients that did present, the most frequent complications were depression and suicidal ideation, which is very common. But importantly, what we were finding in terms of themes from the patients that were presenting is they couldn't access mental health services because, remember, we were in lockdown and quarantine. And so that the patients who had to come to the hospital were more psychiatrically ill, had more intense mental health symptoms, and were more likely to require admission. Also, during that time frame, we were instituting rapid COVID-19 testing. So a substantial subset of the patients that we saw were tested for COVID-19, and many of them were positive. So we were able to compare those patients who were COVID-19 positive to those patients who were not on their psychiatric presentations. And one of the very interesting things that we found, which has been found by others, is an association between COVID-19 and psychosis, particularly two aspects of psychosis. One is in chronically psychotic patients with schizophrenia and schizoaffective disorder who have been identified at increased risk for COVID-19, and also a smaller number of cases of new onset psychosis in individuals who had never previously been psychotic or had psychotic illness. We reported the latter finding as well in a publication that was the first of its kind that has also received a large number of citations of similar reports throughout the world. And so I think the importance of our work was its timeliness, the fact that we published this very early on in the pandemic, as people were and have increasingly identified heightened mental health consequences from the pandemic, both from the stress of the pandemic and now some from the virus itself, because we've discovered that the brain is also vulnerable to the inflammatory effects of the virus. So we've initiated some subsequent research and are following a longitudinal cohort of over 100 individuals from the major different eras of the pandemic, if you will, the Alpha, the Delta, and the Omicron eras of the pandemic. And we continue to follow those patients. So I would really like to express gratitude from myself and from our team for the recognition. But above all, there's no greater recognition of one's research work than to have it cited in the literature. So we will continue on with our work and hopefully be able to continue our important contributions to understanding the mental health consequences of COVID-19. Thank you again.
I'm Dr. Len Newman, Chair of the Department of Pediatrics. It is my pleasure to present these awards for two articles, research articles that published in the journal with the highest impact factor for all authors, and research article with the highest number of citation for all authors goes to Dr. Alok Singh. Dr. Singh's article, multisystem inflammatory inflammatory syndrome in children, initial therapy and outcomes, was published in New England Journal of Medicine in 2021. And his article, second article, which is the characteristics and outcome of U.S. children and adolescents with multisystem inflammatory syndrome in children, compared with severe acute COVID-19 in JAMA in 2021. Congratulations, Dr. Singh.
Hi, everyone. My name is Alok Singh. I would like to start off by thanking Chancellor Halpern, Provost of Research, Dr. Amler, and Dean Nadler for these two awards. The article with the highest citations, which is the JAMA article, describes characteristics of COVID-19 in children and adolescents. And the New England Journal article discusses the treatment of COVID-19 in children. Both these articles build upon research conducted over the last 2 years via a multi-center study of COVID-19. I hope that these papers will go on to help clinicians and help children and adolescents affected with COVID-19 in the future. Thank you very much again.
I'm Joe Etlinger, professor and chair of the Department of Cell Biology and Anatomy. Our department has diverse educational responsibilities, providing anatomy, embryology, cell biology and histology, and neuroscience to all our schools. We also have state-of-the-art research in the areas of cell biology and neuroscience, and it includes work in the fields of breast and prostate cancer, cell biology of viral infection, pulmonary arterial hypertension, stress-dependent effects on gene expression, learning and memory, epilepsy, schizophrenia, spinal cord injury, and head trauma. We were pleased to learn that 2 faculty members in cell biology are being awarded prizes for their publications. The research article with the highest number of social media mentions by a NYMC first author was given to Dr. Linda Friedman. The paper is entitled "Cannabidiol Reduces Lesion Volume and Restores Vestibulomotor and Cognitive Function Following Moderately Severe Traumatic Brain Injury." And this paper appeared in Experimental Neurology. Dr. Friedman is first author, and the other authors are Dr. Hong Pang and Richard Zeman, also in our department. The next award is given to the faculty author who published in the most gold open access journals. And that was awarded to Dr. Eliana Shemis in cell biology for actually a set of papers appearing in ANS Neuroscience, Frontiers in Cellular Neuroscience, Scientific Reports, and iScience. And I should mention that this work includes research in the areas of astrocyte and neuronal connexins and seizures, work on connexins that also are involved in gap junction channels, and also a important study on the role of connexins as a necessary component in COVID infection. Okay, I should also mention that the ANS neuroscience paper was first authored by an MD PhD student who recently finished his research, Price Obat, in our department for his work on connexins and seizures. So we are very pleased to have received these 2 awards. Thank you.
I'm honored to have this opportunity, and I'm excited that our work is getting noticed, and I would like to briefly show the work in a mini presentation. Traumatic brain injury results in a profound local hyperperfusion, ischemia, chronic inflammation, and metabolic dysregulation, which restrict drug delivery to the site of impact, so that peripheral treatment alone would have limited access to the site of injury during the most critical phases of neurotrauma, leading to neuropathology, paralysis, depression, vestibular motor dysfunction, attention deficits, and other cognitive deficits, with increased risk of post-traumatic epilepsy and post-traumatic stress disorder, as well as other psychological problems. We hypothesized that a safe cannabinoid, such as cannabidiol, CBD, which lacks psychoactive effects, but has anticonvulsant, anti-inflammatory, anti-nociceptive, and other neuroprotective effects, can reduce local neural excitation and spare neuronal tissue, reduce pain, and improve neurological outcome. as well as to reduce the risk of drug abuse and epilepsy after a neurotrauma. Moreover, the route of drug administration must be considered to optimize drug efficacy. Therefore, we devised a novel delivery system to apply an absorbable implant infused with CBD and apply it directly to the site of contusion in a preclinical rodent model of head trauma. We further hypothesized that dual treatment with our CBD-infused absorbable implant supplemented with peripheral oil injection would have higher medicinal efficacy than either treatment alone. This slide shows the effect of cannabidiol on lesion volume, shown with H&E staining on the left. In the TBI group, the controlled impact caused large ipsilateral lesions of the cortex and hippocampus, as well as enlargement of the contralateral ventricle. As of course, the ipsilateral ventricle is also enlarged, and notice also enlargement of the third ventricle. And the lesion is noticed at many levels throughout the brain, and there is a protective effect of the dual therapy shown here with smaller lesions on the right, as well as a preserved hippocampus at posterior levels, despite the fact that there's loss of cortex. There was lower defecation scores with the animals with the animals that had dual therapy, suggesting they had reduced anxiety, more similar to the sham controls. This slide shows microscopic examination of the hippocampus at the cellular level between TBI and dual therapy treated animals, and shown with H&E and H&E staining and new and immunohistochemistry. This is the ipsilateral damage and contralateral damage following TBI and the CA1, which is relatively preserved in animals that have the dual therapy, and the hippocampus is also damaged at the level of the dentate gyrus and relatively preserved as well in the animals with the dual therapy, and quantification is shown on the right and can be found in experimental neurology. CBD rescues vestibular motor function. This is the time course of vestibular motor recovery. Notice that the animals with TBI, they improve a little bit in the first few days, and then they remain at this deficient level throughout the duration of the experiment, whereas in contrast, the animals with CBD dual therapy and systemic oil injection improve by 12 to 14 days, and they perform similar to controls. However, when you count the total average beam balance score, the dual therapy animals do a little bit better than the animals with single treatment, suggesting therapy. Dual therapy also improved cognition in the alternating T maze. The spontaneous alternating T maze is a sensitive test to detect hippocampal dysfunction. Control animals spontaneously enter the left and right arms with a tendency to the left, whereas animals with the TBI mostly enter the left. Animals with dual therapy and systemic oil injection, they already show some alternation at 3 days and full recovery with all the CBD treated groups at 28 days. The object recognition memory test was also restored with the dual therapy. I'd like to draw your attention to panel B. Animals following learning, being exposed to the familiar object and then the novel object on the second day. Notice that they spend more time with the novel object. The animals with TBI, they don't visit either object very often. And the animals with the dual therapy also visit the familiar objects less often than the novel ones, suggesting that they get having attention and memory, whereas animals with the systemic IP injection visit both objects equally, so they do not discriminate. And therefore, when you do the object recognition index ratio, only the sham and the CBD dual therapy animals are achieving the proper ratio, almost near 1, and these are most similar to the controls. CBD rescues GFAP labeling bilaterally. There's a marked up regulation in the, throughout the hippocampus after TBI compared to controls that show uniform labeling on the ipsilateral and contralateral side. Notice increased staining also in the CA3 stratum moriens. And there's a downregulation or much lower expression following the dual therapy, which is not achieved to the same extent with alone, suggesting you have less astrocytosis and gliosis and inflammation following dual therapy, which may contribute to the neuroprotection. In conclusion, dual CBD treatment is superior to single treatment. Dual therapy resulted in less damage and best performance in cognitive tasks. Locomotor recovery was restored by dual and systemic methods, but with faster recovery when given CBD injections. Cannabidiol or cannabinoid-based therapy may also be useful for other types of surgery and external wound care, which is under current investigation. And we are now exploring whether the flower extract containing low quantities of THC and other phytocannabinoids has greater medicinal effects than CBD derived from hemp. We will be presenting this work at Society for Neuroscience and the annual epilepsy meeting in Nashville. And thank you for your attention and for this opportunity to share our work.
I am a professor of cell biology and anatomy with a research interest in the basic mechanism involving intercellular communication mediated by gap junction proteins, connexin and pannexins under pathophysiological conditions of the nervous system. Our recent studies have shown that the organizational features of gap junction at the astrocyte and feet impact the barrier function of the neurovascular unit. Particularly, we showed that the C-terminal binding domain of connexin 43 is an important determinant of aquaporin aggregates and connexin 43 plaques that maintain water and solute homeostasis, and that we showed that the disruption of these proteins impact brain edema and blood-brain barrier permeability. The other two studies are related to the role of another member of gap junction proteins, the pannexins, that under normal conditions, these pannexin channels are closed, but under pathophysiological conditions, these channels become activated. In the iScience paper, we showed that SARS-CoV can activate pannexin channels, leading to the release of ATP, PGA2, and interleukin-1 beta. In the other study, published in IS Neuro, we show that pannexin are open during seizures, and that astrocyte and neuron of pannexin contribute to different aspects of the ictal activity.
Dr. Len Newman. It is my pleasure to present these awards to Dr. Barbara Romaine, who is in our department. She received accolade for the research article with the highest number of mentions for New York Medical College first author, and research article with the highest usage for New York Medical College first author. Dr. Romaine's article is entitled Prevalence of COVID-19 in Adolescents and Youth Compared to Older Adults in States Experiencing Surges, which was published in PLOS One in 2021. Congratulations, Dr. Romaine.
This is Dr. Barbara Romaine, and I'm going to be talking about a study that we did on COVID-19 in adolescents and youth versus in older adults. Previous studies that were carried out in the early days of the pandemic suggested that teenagers were not particularly susceptible to getting COVID-19. But research since then has had mixed results, with some studies showing equal rates of infection among all age groups and others showing susceptibility increasing with age. But many of these results may have been affected by lockdowns and school closures, limiting the activity of young people, as well as limited testing. Summer 2020 presented an ideal situation to test whether young people were less likely to get COVID-19. There was a general easing of restrictions, and teens were on summer break and more likely to socialize. We examined data from 6 states that were experiencing a surge in cases and compared rates among teens and young adults up to age 24 with older adults, age 60 and older. In all 6 states, the prevalence of COVID-19 in teens and youth was actually greater than the prevalence in older adults. For example, in Florida and Utah, 2.2% of the population of 15 to 24-year-olds were infected with COVID-19, whereas only 1.1% of adults 65 and older were infected. The study does not show that young people are more susceptible to the virus than older adults. but it does suggest that they may expose themselves more to it and are not particularly protected from it. Young people are less concerned with getting sick and less likely to curtail their socializing because of any concern about COVID-19. We need to have better messaging aimed at young people because they are likely to get COVID-19, and when they do, they become carriers of the virus. Moreover, even if adolescents have cases that are mild or asymptomatic, some of these will end up becoming long COVID. The greater the number of cases to begin with, the greater the number that will end up as long COVID. Therefore, we need to have the messaging out there that the infection rate in adolescents and youth is high, so that adolescents and their parents can make informed decisions about vaccination and about wearing masks in school and other settings. Thank you to Chancellor Dr. Halpern and Provost Dr. Amler, and to Marie Asher, Director of the Capozzi Library, for acknowledging this work and for the 2 awards I'm receiving today.
Hello, my name is Dr. Jerry Nadler, Dean of the School of Medicine, and it's my honor and privilege to participate in this faculty recognition event for scholarship, since one of the most meaningful experiences for me as Dean of the School of Medicine is to have the opportunity to recognize scholarship by our faculty and our other learners. This year, I'm very pleased to recognize the Department of Dermatology as a School of Medicine department with the highest percentage of faculty published. An impressive 62% of the dermatology faculty were published in 2021. Of particular note are the numerous papers that represent important, relevant, and interesting work around the care for the underserved communities with regard to telehealth, teledermatology, and investigating factors of race and gender in dermatologic care. For example, one of the highest cited papers for the department in 2021 was entitled "A Surge in the Incidence of Telogen Effluvium in Minority Predominant Communities Heavily Impacted by the COVID-19 Pandemic." This study was published in one of the major journals for dermatology. Now, this accomplishment of the department is due in large part to the leadership of the chair, Dr. Bijan Safai, chair of the Department of Dermatology, who will be giving an introduction to accept the award on behalf of the department. I just want to say a few words about Dr. Safai, who has been chair of our department, and we're very fortunate to have Dr. Safai here since 1993, when he accepted the position, where he's been involved in education and training of dermatology residents and medical students ever since, and leading a major research program in the department. Dr. Safai has also, since 2012, been very active in leadership in the physician group in New York City Hospital called New York City PAGNI, which is one of the largest physician groups in New York in the United States. Dr. Safai has published over 200 articles. He was the chair and director of dermatology at Memorial Sloan Kettering Medical Center and became a professor of dermatology at Cornell. And Dr. Safai in 1978 and 1980 was a major leader in the understanding of the AIDS epidemic that was in terms of Kaposi sarcoma being caused by a virus that later was determined to be AIDS. So Dr. Safai, we're very excited to have you here at New York Medical College, and you're running a wonderful department. I want to now introduce Dr. Safai to say a few words. Thank you.
Good afternoon. Thank you very much, Dean Nadler, for your nice introduction and kind remarks. I'm delighted and honored to accept this award in the name of our Department of Dermatology at New York Medical College, in the name of our devoted faculty and hardworking residents, and of course, in the name of our 20 or more medical students who have contributed to this interesting publication. Dean Nadler mentioned my work during the AIDS epidemic. Let me say a few words about that before talking about our current work. I was fortunate to be able to make major contribution to the understanding of AIDS epidemic My prior work clearly demonstrated that Kaposi sarcoma was a virally induced human tumor which only appeared when the host immune system was impaired, and that the virus causing Kaposi sarcoma was from the herpes family of viruses. We further showed that we were not facing an epidemic of human cancer, but a viral infection causing immune deficiency, in which setting a lot of patients developed Kaposi sarcoma. Our team were able to contribute to the isolation of the virus, developed and published the first 8 tests, and participated in the development of first 2 drugs used for the treatment of AIDS, namely DDC and DDI. I would like to take a moment to once again thank New York Medical College leadership for giving me the opportunity to lead this Department of Dermatology for over 29 years. I think I have broken the record of Dr. Lenny Newman, once one of the longest serving chairs in New York Medical College. In early 1993, I inherited one of the most challenging jobs at New York Medical College. But I knew that the challenging situation usually comes with many opportunities. Over a quarter of a century later, I feel proud and very fortunate to have had the opportunity to train more than 100 well-qualified and successful dermatologists. We have participated in training of medical students and provided dermatologic care for hundreds of thousands of patients. And more importantly, we contributed to the advancing dermatologic knowledge in diagnostic and therapeutic areas. The challenging problem of COVID-19 pandemic provided us once again with great opportunities. We realized that with a rapidly spreading pandemic and the restriction caused by it, access of care had become a major problem. So one of the areas we started to specifically focus on was expanding access of care for underserved patients via the use of telemedicine. We know that under-resourced setting, social and financial stressor are significant impediment to engagement with the medical system and new technologies. Such challenges could be mitigated by the use of telemedicine. Conversely, telemedicine may exacerbate the exclusion of marginalized communities that have lower rate of digital literacy, internet connectivity, and smart device ownership. To address the rapidly challenging landscape of care delivery, our department implemented novel workflows and approaches specifically designed to simplify access for vulnerable patient population. Using appropriate patient selection, triage, telephone, text messaging, video conferencing, patients that had difficulty accessing the patient portal were able to easily connect with our dermatologists remotely. Our approach not only increased access of care, but also reduced the no-show rate of scheduled patient, which normally runs about 30%. This approach allowed our faculty to provide much closer teaching and supervision as well for our residents and students. And more importantly, we are able to expand our clinical research activities. Our investigation allowed identifying some of the skin manifestation of COVID-19 infection, as well as some of the rare side effects of vaccination. Our work resulted in numerous publications in the top dermatology journal in the country, and some of our members of our faculty have also been granted multiple awards in recognition of their work. I'd like to mention Dr. Abigail Klein, the chief resident this past year in New York Medical College Dermatology, and now a faculty member in our department. Not only she complied much of the data for the telemedicine project, but due to her exceptional teaching skill, she also involved a significant number of New York Medical College medical students in our research project. For her work mentoring the New York Medical College medical student, New York Medical College was awarded her the Gold Humanism Honor Society Award. And she also was given by the American Academy of Dermatology the Rising Star of Dermatology Award. Dr. Shoshana Marman, an assistant professor of dermatology at New York Medical College, who designed and spearheaded our telemedicine initiative, was recently presented with the Ambulatory Care Performance Involvement Award by New York City Health Plus Hospital, the largest safety net hospital system in the United States. She was also the recipient of the Innovation in Quality Improvement Award and named a National Patient Hero by the American Academy of Dermatology. Once again, we are grateful to New York Medical College leadership for recognizing our group's hard work and contribution. Thank you so much and have a wonderful day.
Hello, my name is Dr. Marina Holz. I am the Dean of the Graduate School of Biomedical Sciences here at New York Medical College, as well as Professor of Cell Biology and Anatomy and the Interim Chair of the Department of Biochemistry and Molecular Biology. Thank you for joining us for this author celebration. One of the most important achievements in the life of a scientist is publishing a research paper or a review paper that is a culmination of many years of painstaking work. This year, the Department of Physiology wins the award for the department in the School of Biomedical Sciences with the highest percentage of faculty who published in the year 2021. In fact, 61% of physiology faculty published a paper during that year. It is an incredible achievement, and I would like to congratulate all the authors and everyone else who contributed to these papers. And I would like to invite Dr. Christopher Leonard, Chair and Professor of Physiology, to accept the award on behalf of his department. Congratulations.
Thank you, Dean Holtz. I'm Chris Leonard, and as the interim chair, I'm delighted and honored to accept this award on behalf of the Department of Physiology. In 2021, our department had the highest percentage of faculty who published in the School of Biomedical Sciences. As you know, physiology is foundational to medicine and has as its central goal the understanding of how molecules, cells, tissues, organs, and organisms operate. Function is understood using both a reductionist approach to delineate the parts of these complex systems and through an integrative, synthetic approach to understand how function emerges from the interaction of these parts. Our published research, which involves 61% of our faculty, spanned multiple levels of organization in the study of the cardiovascular, pulmonary, renal, and central nervous systems. Published studies addressed numerous interesting issues, including how genetically encoded fluorescent voltage indicators work to sense transmembrane voltage, what is the microRNA blueprint of endogenous cardiomyocytes, what is the role of sex hormones in lung disease, how malnutrition impacts kidney development, and the possibility that somatic stem cells can inhibit the development of hydrocephalus following intraventricular hemorrhage. So thank you for this recognition, and congratulations to the Department of Physiology. Keep up the great work, and let's make next year even better. Thank you.
Good evening, everyone. I'm Dr. Robert Amler. Thank you for this quick minute for me to congratulate our department and faculty in the Department of Public Health in the School of Health Sciences and Practice and Institute of Public Health. With some 20% of our faculty publishing, it's clear we've had a very productive year. Despite all the manifest changes of COVID, we've run at a distance an academic unit with 3 different degree programs and an array of offerings in advanced graduate certificates from children with special healthcare needs to global health and disaster medicine. Among our many recent published contributions are management of obesity in children with asthma using telehealth, ambient air pollution health hazards to children, sulfur mustard and its effects on the conjunctiva, intergovernmental partnerships in public health emergencies. So congratulations to all our authors and all authors at NYMC for this extra measure of effort in contributing your new knowledge, hard-earned, to the global community of scholars. It's now my privilege to introduce Dr. Mark Kittleson, the chair of the Department of Public Health. Dr. Kittleson.
Greetings. I'm Mark Kittleson, Department Chair of Public Health at New York Medical College. And once again, I am thrilled to represent the department's status of publication, largest percentage of publication for faculty in the School of Health Sciences and Practices. This is a continuing process that we're very proud of. I can't tell you how absolutely thrilled I am with our faculty. They are productive. They have a very heavy teaching load. They are heavily involved in the community, and they're really committed to students. And yet they're still able to publish and present and do a lot of scholarship. So again, I thank the library for acknowledging their work ethics and their level of commitment. Just want to quickly identify some of our key people. In public health, we have 5 divisions. We have health policy and management, and we have Dr. Adam Block, Dr. Ken Knapp, Dr. Denise Tahara, and Dr. Minnie Murthy. All have been very active in scholarship. In health behavior and community health, we have Dr. Penny Liberatos, Dr. Chia-Che Cheng, and Dr. Nisha Bahari, new faculty member. Again, all been very productive. In epidemiology, we have Dr. Maureen Kennedy, Dr. Elizabeth Drugi, and a relatively new faculty, Dr. Megan Work. Again, very productive in the scholarship. In our Great Bowel Statistics Division, we have Dr. Shuhu Shi and Dr. Hei Young Kim. Again, are very productive, working with a lot of people in their statistical analyses and getting a lot of publications. And finally, our environmental health, which has Michael Shikarjian. Dr. Shikarjian's been a great addition or a great person in the department. Dr. Hung Duck Kim and Dr. Amy Ansel. Again, those are our full-time faculty. We also have just an incredible array of adjuncts. I can't brag about them enough. And not only are they great teachers, but they're also very active scholarship. And so we're proud that they are part of our public health program. So once again, for the library staff, thank you for taking the time to promote and support the scholarship productivity of faculty at the New York Medical College. And as the Department of Public Health Chair, I am grateful for all of your services and to all my faculty.
I am overwhelmed with gratitude to have been selected to receive the New York Medical College Bibliographer Extraordinaire Award. Thank you all so much for being here to share in this event. I am so honored to have my work recognized in this way by the Capozzi Library. Many enjoyable hours were spent in creating the faculty bibliography, and it means so much to me that the work that I am so passionate about also resonates with others. This accomplishment is not something that I did alone, and there are many others who deserve to share in this award. I would especially like to thank Cheryl Silver, Daniel Aloya, and Jeanette April, who provided invaluable assistance. I will always remember with fondness my interaction with all the New York Medical College faculty authors.